Hello, everyone. My name is Georgette Bradford. I'm a healthcare worker and the president of SEIU-UHW African American Caucus. SEIU-UHW is a healthcare justice union of more than 100,000 healthcare workers, patients, and healthcare activists united to ensure affordable, accessible, high-quality care for all Californians, provided by valued and respected healthcare workers. We're here to talk about Assembly Bill 1204, the Race and Healthcare Transparency Act, authored by Assemblymember Buffy Wicks and sponsored by SEIU-UHW. Assemblymember Buffy Wicks represents the East Bay, including Oakland, Richmond, and Berkeley. A lifelong community organizer, Assemblymember Wicks previously served on both of the President Barack Obama's campaigns and worked for him in the White House. Thank you for joining us, Assemblymember, to talk about this important work.
Thank you so much, Georgette, for having me, and to all my good friends at SEIU. I'm just honored to be here with you today, and really, truly honored to have worked with you all on this legislation. I think it's going to be pretty imperative moving forward. So excited to be here.
Well, Assemblymember, you've had a long career working in health policy. Could you tell us more about your work on the Affordable Care Act?
Sure. So I was lucky. I got on the Obama campaign. I was employee number 32 back in early 2007. When he was running against Hillary Clinton, and none of us thought, or most people didn't think, a Black guy with the middle name Hussein could be the president of the United States. But a handful of us did, and I know many of you on this call were part of that team, and so thank you for that work. And so I worked with him for almost 2 years on that campaign, and then I was really lucky and honored to go into the White House. But part of the reason I worked for him was because his commitment to healthcare and to ensuring that everyone had access to healthcare. And that was really because of personal experiences that I've had with my friends, my family, and others in terms of their access to care. And one situation in particular, one of my very good friends and roommate at the time had tested positive with HIV back in 2004. And he had called me and said, "Can you pick me up from the clinic? I tested positive." And I went down to the clinic and I sat with him and the nurse, and I learned about T-cell counts and viral loads and all that kind of stuff that I didn't know that much about, frankly. And then when we got into my car, he turned to me and said he didn't have any health insurance. And that was unfortunately one of many stories of people in our country, one of the wealthiest nations in the world, who people don't have access to care. And so I made a pretty conscientious decision right then and there that I wanted to be a part of the change, to change our system. And so, I ended up working for Barack Obama, and then I got to work on the Affordable Care Act when I was in the White House. I was the deputy director of the Office of Public Engagement and helped organize a lot of the advocacy organizations to push for the ACA. And I was really lucky to be in the Roosevelt Room the night of the vote with the president and the whole senior leadership team when we passed the Affordable Care Act. And it was such a joyous night. We ended up actually going to the residence that evening for drinks. President doesn't drink that much, so it was kind of unusual to see him with a cocktail. But we'd all worked so hard, and it was really exciting. And so that was a really pivotal moment for me in terms of really recognizing that when we work together, when we organize together, when we have a shared vision and a shared purpose, and we stand shoulder to shoulder, that we can achieve change. And so healthcare is one of the things I really care about. And I know SEIU was along in that fight as well. So been working side by side with you all for a very long time.
And so happy to have you with us. And I remember that vote, staying up late to watch that vote live, how thrilling it was. And we're glad to still have you working as a champion with us in the state legislature and for healthcare workers as well. Now, even though access to healthcare has improved since then, there's still so much work that needs to be done as far as equity and the quality of healthcare. Black and Native women die in childbirth at rates 2 to 4 times higher than white women, and Black infants are twice as likely to die before their first birthday. It's estimated that 2/3 of pregnancy-related deaths in the US are preventable. It's absolutely unacceptable, especially in this rich state, to see something like that happen. And that's why SEIU-UHW members know that there is no healthcare justice without racial justice. So we've turned to you, Assemblymember, to work on legislation to address these injustices.
Well, I appreciate that. And, the systematic racism that exists in our society literally starts in the womb. I mean, you said it correctly. You know, women of color are disproportionately have less access to care. Their babies have less access to care. You know, and we've done a lot of good work, I think, in this space recently, just this year with this bill. Also, Senator Skinner did the Momnibus bill. So my hope is that we'll bring some light into this issue. But it, like I said, the systemic racism starts before our little babies are even out of the womb, and so we have to really fundamentally address that. You know, and you look at the health disparities in my own community. If you are from West or East Oakland, from a Black or brown community, you are living on average 10 years less than someone who is from the Oakland Hills who is white. And that is the reality of our world. And so the only way that we can really combat the systemic racism that exists in any of our systems, criminal justice system, education system, but in the healthcare system with this bill, is to shine a bright spotlight on that and understand the data, understand where this is coming from, understand the facts, so that we can create evidence-based policies to address the systemic racism that exists in our society. And I think COVID-19 has shined a very bright spotlight on that. When you look at who's impacted most by COVID-19, it is our Black and brown communities. That is who is dying more. That is who is on ventilators more. That is who's getting less care. That is who's getting less testing. That is getting who's less vaccines, right? So we have to be very intentional about how we address this issue and have some very uncomfortable conversations and some uncomfortable truth around the systemic racism that exists here. And it's not just at childbirth. If you look at diabetes, if you look at asthma, hypertension, there's a number of issues that that impact our communities of color more. So the whole goal of this bill is to shine a big spotlight on that, so we can create policies to fix this problem as best we can.
You know, Ed, I think that's what's so critical about AB 1204 is, as you said, Assemblymember Wicks, COVID did shine a big spotlight on the systemic disparities, but AB 1204 allows us to shine that spotlight on the data so we can fix them at the source. So I would like to introduce some members on the call who've had direct experience with these disparities, and would like them to share their stories of why AB 1204 is so needed. And we would like to start with Ceci Gomez-Gonzales. We'd like to welcome her to the call. And Ceci, can you tell us a little bit about your experiences?
Yes, definitely. Hello, Assemblymember.
Hi.
Like Georgette said, I'm Cecilia Gomez-Gonzales. I'm from the San Gabriel Valley, East Los Angeles County, and I'm a member of Healthcare Justice, which is community members, volunteers, and patients who fight for this quality, affordable healthcare for all. Now, I'm a community team leader for Healthcare Justice. Now, what happened to me was one time I went to the dentist, and it was just a routine appointment, and I didn't even have any serious work done. I had to get my teeth cleaned. And so I went in, and you know how they give you a little bit of numbing, you know, little numb shots. And she told me if it hurts anymore, let me know. And it started hurting. So she's like, okay, let me give you a little bit more. So unfortunately, I had a really bad reaction to that anesthesia. And my body went completely, my whole from head to toe body went completely numb, and rather than just my mouth. And they were really scared, and we're attached to a clinic, a healthcare clinic. It was all one system. And so they called the trauma team over, and they said, no, we need to get her to the ER. So I went to the ER because I couldn't move anything. They initially diagnosed me with a stroke. That was the idea they had. But fortunately, it wasn't. It was just a bad reaction to the lidocaine. So, but anyway, I get over there, and this was when it was, you know, it was last year. And so it was in the middle of COVID, really bad. And so they just basically dropped me off and took off, the fire department. And so when they left me there with the hospital staff, I got absolutely family treatment in the dental office and from the fire department. But when they left me at the hospital, which was literally across the street from the dentist office, it was a completely different story. So I wasn't talking, and it was just really horrible the way I was being treated. I don't know. I was thinking that they were thinking I was homeless or something, because I was shoeless. I was just barely wearing a t-shirt, and my hair was all messy because I don't know what happened to me on the way, but I really think that that's what they were thinking, and the way they were talking to me, and I couldn't move, I couldn't talk. So when she was asking me questions, what's your name, where do you live, and then I'm like, that's how I was talking, because I couldn't open my mouth. And so she was just like, well, where do you work? Wait, do you have a job? And it was just horribly being treated that way. And I was completely vulnerable. And they just stuck me in the waiting room and just left me there for hours. They didn't bother with me. And when they would come and like do my blood and then leave, and just one person actually who did my EKG, he had to wheel me away because he had to unbutton my shirt. Pull my shirt down. He was the only one who showed any kind of decency to me. He fixed me on my chair. He pulled my my feet up in the actual holders because they were dragging on the floor. And he's like, don't worry, it's gonna be okay. You're gonna be fine. He was the only person who showed me any decency. All of them should have showed some decency to me. All of them did, but he was the only one. And so that's why we need AB 1204. Everyone should be able to be treated with respect when they are having an emergency and need care. They need quality care. Everybody deserves that.
Mm-hmm.
Thank you, Cecilia. We shouldn't have to worry about the way we look, what zip code we're from, having to determine the way we're treated when we come and get care. And that's why AB 1204 is so important. I'd like to introduce next Rexie Dixon, who's going to give you a little bit of information on his experiences and why he feels that 1204 is also so important.
Good morning, Assemblymember. My name is Rexie Dixon. I work at Alameda Hospital Surgery Department. I'm an executive committee member and the president of Asian Pacific Islander Caucus of UHW. Asian American and Pacific Islander is the fastest growing population in the United States. Our community includes great diversity within AAPI. However, I have seen Asian Americans who were put at the back of the healthcare treatment. And since I work at the hospital, I work in the OR, one time I went to the emergency room and just to get something. And I noticed that there was this Asian, I believe she's Vietnamese or Chinese, who went there. But she's struggling with her, with her communications. So they don't, the people in the AR probably, I know we're there, they were busy, but the thing is, they don't want to, give respect or mind her in spite of the fact that she's already in pain. It's because she cannot, she cannot speak English. Mm-hmm. So I think for me, I want to help, but for me, I don't know how to speak the language, as the case may be. So I think that's not fair for patients not to be treated right away, especially when they are in pain. Mm-hmm. And I believe that, with the passing of this 1204, I think this will give everybody a chance to be treated fairly and with dignity. So I'm asking that this and praying that this bill should be passed. That's my thought. Thank you.
Thank you.
Thank you, Rexie, for highlighting the unequal access to care due to language barriers. We are a melting pot, not only in the country, but in the state. And so regardless of your language, you should be treated equally and with the same quality of care as everyone else. So I appreciate that. Thank you, Rexie. And next we have Shama Aslam, who's going to also talk to us about why AB 1204 is so important.
Good morning. My name is Shama and I live in Stockton, and also I am an advocate of the Healthcare Justice Program, and also I'm on the e-board. And my story, it just every time I think about it, it traumatizes me because I always looked at everyone as equal, and this is the reason I went into social work. I been doing social work for many years, and then recently I got sick. In any case, after this, after having my urinary incontinence, I had several surgeries to fix that problem, and each time I was told it's a minor surgery. It was an outpatient surgery. They did it, and after my having to fix that several times, I'm needing to fix it several times. I had actually 3 surgeries just to fix that one problem. And then after that, my uterus dropped and I had to get surgery for that. I was very scared because I had a very bad experience with the first surgery. So I went in and they did my surgery. I came home. Literally, I could not walk. I was in so much pain. I figured, okay, it's a new surgery. I just did it. It's gonna take some time to get it, for the medications to kick in, or it's going to take some time, maybe a day or two before I have some relief. Then I came home, I lay on the couch literally for 2 nights. I could not move on the same position. My husband tried moving me. I said, please don't move. I was in so much pain and they could not give me any more medication than I already had. I called my friend on the phone. I could talk, called her and I told her what was going on because she knew I was going to go in for surgery. And she goes, this doesn't sound right, because she had a similar surgery, and because it didn't sound right, she said, I'm going to come right over. And she did. When she came over, she's like, oh, you don't look good. I go, what do you mean? She go, you should not be having this much pain. This is the second day. I had the same thing and I was already walking the second day. It's a simple surgery. I go, I don't know, but don't touch me. Don't move me because it would hurt so much. She said, no, you know what? Don't move. I'm going to call ambulance. We went to the medical center, and when we got there, and keep in mind that my husband, he has a PhD. I have my master's in social work. I advocate for a lot of people, but for some reason, the hospital, the nurse, nobody was listening to me or my pain. And they kept telling us, well, you know what, the doctor's not here. She's not here, so you guys gonna have to just go home and give a couple of days. You'll be okay. My friend, she is Caucasian. And what she said was, she's like, you know what, we're not leaving until we see the same doctor that performed the surgery. And I think we were there for several hours. And finally, the same doctor that performed our surgery, she did show up. She told him the situation. She said, you know what, you need to redo the surgery right now. We're not leaving until you redo the surgery today. And then we're going home. Otherwise, we're going to sit here all day. You have to fix it. This is not normal. And anyways, to make the story short, they did take me in after many hours, and they redid the surgery. What they found out was they had impacted one of my nerves in my leg. So, so whatever they sewed one of my nerves, and that was the reason I could not move. When she redid the surgery, she did inform us that she unstitched the nerve, and immediately I felt a relief. It was amazing. It was just like a miracle, and it was a very simple fix, and yet it took all of us and many days and so much pain to get that through. And I still remember the pain because it was so bad. I think without my friend, I don't think I would have had any results. I would have had still been suffering. They would have sent me back home and would tell me, just wait, it'll heal by itself, this and that. So, I'm so glad that AB 1204 is helping to fix this kind of problem, because the skin, at the end of the day, we might think, the people who are different color might think it doesn't matter. The skin color does matter. And, that was one of my experiences where I really saw the difference in my entire life. I always gave the benefit of the doubt, but it was such a obvious thing that day, I would say, that happened to me, that I really, really appreciate what all of us are doing. And thank you so much.
Thank you so much for sharing, Shama. The heartbreaking thing is her experience is not uncommon. There are so many stories of men, women, and children of color not having their pain taken seriously, not having their complaints taken seriously. and it's leading to adverse outcomes, unfortunately. Assemblymember Wicks, can you tell us how AB 1204 can fix some of the problems we've heard from our members on the call and their experiences?
Yeah, well, one, I want to thank Cecilia, Rexie, and Shama getting on and telling their story. And those are the reasons why we did this bill, are those exact stories. And this bill is about collecting data around this, but behind those numbers are human beings and people who are having these experiences. But the truth of the matter is, you all know anecdotally what's happening out there, but we don't have the hard facts to prove it so that we can then create the change that we want to see. So the whole point of this bill is to do that. And it requires hospitals and health systems to prepare and annually submit an equity report to the Department of Healthcare Access and Information. So in writing, data around demographic information, vulnerable populations, and how they are being treated or not at our healthcare facilities. So that that report's going to be really, really critical. It requires the equity report to include a plan to address the 10 widest health disparities across key performance areas. And so making sure we have some action we can put in place here to address these issues. And then it also establishes a healthcare equity measures advisory committee to evaluate and review appropriate measures that all of our hospitals and our healthcare systems are required to report in with their annual equity reports. And so I think that data is going to be really critical so that we can address these issues and we don't have these stories time and time and time again.
We are thrilled that Governor Newsom has signed AB 1204 into law. Hearing what that law does, Assemblymember Wicks, what can we expect moving forward?
Well, moving forward, it will go into effect January 1st, 2022. So right around the corner here, and it's going to ensure that our hospitals and our healthcare systems are going to be held more accountable so that situations like this don't happen again. And that's the goal. And also for the healthcare systems that are doing a good job and are not having these types of problems, that data will come through as well. And we can celebrate the good work that our healthcare systems are doing. And I also recognize the work that our nurses and doctors and support staff do in these hospitals, and they are our essential workers through this time of COVID. So it's nothing personal. It's about data and facts so that we can address these problems. So that's what's going to happen. It's going to go into effect, and then we'll get more information. So hopefully we can not have these stories happen anymore.
No, and these are more than just numbers. Like you said, Assembly member, these are insights into improving the health of millions of people across California. And on behalf of SEIU-UHW, thank you for being our legislative champion on AB 1204 and improving healthcare quality for all Californians.
Well, thank you all for what you do. You all were with me side by side through this whole process. And the legislative process is not an easy one. It's not a fast one. And sometimes it feels like you're going, 2 steps forward, 1 step back, but you all were shoulder to shoulder with me and many others on this bill. So thank you all. And I look forward to working with you again on more issues. I always want to work alongside SEIU. So really appreciate your work.